As individuals grow older, their bodies begin to communicate in subtler ways through a quiet ache, an unexplained fatigue, or even something as seemingly simple as persistent itchiness. Unfortunately, most people brush off these minor signals, assuming they are nothing more than dry skin or environmental irritation. However, to those well-versed in the health of aging populations, an unusual itch is far more than a trivial nuisance. It can serve as an early warning sign, pointing to deeper concerns involving circulation, the nervous system, liver and kidney function, or nutritional deficiencies. Years of clinical observation have shown that specific areas of chronic itchiness in older adults often correspond with underlying health challenges. Recognizing and understanding these signs can make a critical difference, not only in extending lifespan, but in preserving mental clarity, physical strength, and overall quality of life. In this article, we will explore four distinct areas where persistent itchiness carries important messages about internal health. More importantly, we will discuss how to identify these warning signs early and take proactive steps to address them before they evolve into more serious conditions. It is never too late to listen more closely to what the body is trying to say and to respond with wisdom, care, and intentional action. 1. Persistent itchiness on the lower legs. One of the most overlooked yet telling signs of deeper health concerns in older adults is persistent itchiness on the lower legs. While many dismiss it as simply dry skin or a normal part of aging, consistent itching in the calves, shins, or ankles, especially without a visible rash, may signal an issue that deserves closer attention. Clinical observations have linked this specific symptom to poor circulation, particularly a condition known as peripheral artery disease, PAD. In PAD, blood flow through the small vessels of the lower limbs becomes restricted, leading to dryness, sensitivity, and chronic itchiness in the skin. Consider two individuals, Harold and Dennis, both in their early 80s. Harold maintains an active lifestyle. He enjoys morning walks around his neighborhood and regularly checks his legs and feet for any unusual changes. He remains in good health. Dennis, by contrast, has grown increasingly sedentary. He spends long hours sitting, often feels fatigued, and has recently noticed an ongoing itch creeping up his lower legs, especially during the night or after prolonged periods of sitting. Applying lotion provides little to no relief. What Dennis does not realize is that his persistent itching may be his body's subtle cry for help. Reduced blood flow to the lower extremities not only dries out the skin, but also weakens muscles and tissues over time, putting additional strain on the heart and vascular system. Poor circulation has been associated with an elevated risk of heart disease, stroke, and cognitive decline. The legs are often referred to as the second heart because of their crucial role in returning blood to the upper body. When they are struggling, the entire circulatory system suffers. The encouraging news is that early intervention can make a significant difference. Gentle leg exercises, regular short walks, elevating the legs while seated, and wearing comfortable compression socks can all help to promote healthier blood flow. Staying well hydrated and reducing salt intake are also important steps in supporting vascular health. If an older adult experiences persistent lower leg itchiness without an obvious cause, especially in the absence of rash, allergy, or injury, it is wise not to ignore it. The body often whispers before it shouts, and in this case, a simple itch might be one of the earliest signals urging action for better health. 2. Unexplained itching on the upper or mid-back. An itch on the upper or mid-back can often feel like just an inconvenience, an unreachable spot that needs a scratch. But when this itch becomes persistent, appearing without a clear external cause such as dry skin or irritation from clothing, it may be a signal of something far more serious. Among older adults, unexplained itchiness on the back has been associated with underlying dysfunction in two of the body's most vital organs, the liver and the kidneys. Both organs are responsible for filtering toxins and maintaining the body's internal balance. When they begin to struggle, waste products can accumulate in the bloodstream, leading to skin irritation, particularly in areas dense with nerve endings, such as the back. Take, for example, two women, Dorothy and Janice, both 76 years old. Dorothy maintains good hydration, attends regular medical checkups, and generally enjoys healthy skin. Janice, however, has recently noticed increased fatigue, swelling in her ankles, and persistent back itchiness, particularly at night. She has tried changing her laundry detergent and moisturizing her skin regularly, yet nothing brings relief. What Janice does not realize is that her body's internal systems may be under strain. Compromised liver or kidney function often presents first through persistent, unexplained itching. Itching that does not respond to typical remedies and often worsens at night, further disrupting sleep and draining physical resilience. More concerning, chronic skin itching linked to organ dysfunction has been associated with shortened lifespan, not because the itch itself is dangerous, but because of the serious internal imbalance it reveals. Fatigue, swelling, digestive disturbances, and mental fog often accompany these deeper issues. However, there is hope. A simple blood test can assess liver and kidney function quickly and effectively. Hydration, a diet rich in whole foods, limiting alcohol, minimizing processed foods, and monitoring salt intake can ease the burden on these critical organs. Additionally, older adults taking multiple medications should discuss potential impacts on liver and kidney health with their physicians. When an itch arises on the back for no clear reason, it should not be casually dismissed. The skin is often the body's early messenger for deeper imbalances. Listening carefully could be the key to preventing more serious health challenges down the line. 3. Frequent itching on the scalp or neck. Persistent itchiness on the scalp or back of the neck is often dismissed as a minor annoyance, perhaps a reaction to shampoo, seasonal dryness, or simply another aspect of getting older. Yet for many seniors, this type of itching can be a signal that runs much deeper than the skin surface. The scalp and neck are highly sensitive areas, rich in nerve endings. They are often among the first to react when the body's stress response or nervous system is under strain. Chronic itching in these regions may reflect not just physical discomfort, but also underlying emotional tension, chronic inflammation, or subtle changes in neurological function. Consider two men, Leonard and Ray, both in their late 70s. Leonard remains socially active, enjoys gardening, and practices light meditation in the evenings, maintaining a sense of emotional balance. Ray, on the other hand, has struggled with feelings of restlessness after retirement. He spends more time indoors, watches television late into the night, and carries quiet but persistent stress without fully realizing it. Over time, Ray began experiencing a constant itch on his scalp and the back of his neck. First it appeared in the evenings, later it became a daily irritation. He tried switching shampoos, changing his pillowcase, even adjusting his diet, but the itch remained stubbornly present. What Ray did not realize is that chronic emotional tension can manifest physically. As the body ages, the stress response becomes less efficient. Instead of resolving tension quickly, the body may remain in a prolonged low-grade state of alert, keeping cortisol levels elevated and immune function suppressed. This state can lead to physical symptoms such as nerve hypersensitivity, expressed through chronic scalp and neck itching. In some cases, persistent itching in these areas has also been associated with neuropathy and early cognitive decline, not as a definitive diagnosis, but as a subtle warning to take better care of the nervous system. Fortunately, there are effective strategies to calm this internal stress. Simple habits such as practicing deep breathing, spending time outdoors, limiting exposure to distressing news, journaling before bedtime, and reconnecting with friends and loved ones can help regulate the body's stress response. In Ray's case, small but consistent changes, morning walks, evening phone calls to his brother, and a conscious effort to disengage from constant media led to gradual but noticeable improvements. The itching lessened as his inner tension began to lift. If persistent scalp or neck itching arises without an apparent external cause, it is essential to look beyond the skin and ask deeper questions. How is the emotional health? Is there unresolved stress quietly taking a toll? Because sometimes an itch is not just about the skin, it is the nervous system's way of asking for peace. Ongoing itching around the chest or abdomen. When considering early signs of declining health, most people think of symptoms such as shortness of breath, dizziness, or memory lapses. Rarely do they consider persistent itchiness across the chest or abdomen. Yet this often overlooked signal can reveal critical insights into an older adult's internal health, particularly regarding nutritional status and digestive efficiency. Persistent, unexplained itching across the torso, especially in the chest and abdominal regions, may point to underlying nutritional deficiencies or malabsorption issues. As individuals age, their digestive systems naturally become less efficient at absorbing essential nutrients like vitamin B12, zinc, magnesium, and essential fatty acids. Even when weight appears stable, the body may quietly be starving for the building blocks it needs to maintain strength, repair tissues, and support immune defenses. Consider two women, Joyce and Elaine, both 81 years old. Joyce remains attentive to her nutrition. Although she eats smaller portions than she once did, she ensures her meals are colorful and balanced, including fruits, greens, and sources of lean protein. Elaine, however, has gradually lost interest in food over the past year. She often skips meals, relies on crackers or canned soup, and feels full quickly. Alongside these changes, she notices a growing itchiness across her chest and belly, often more pronounced in the evenings. Attempts to change soaps and body lotions yield no relief. What Elaine does not realize is that her persistent torso itching may be her body's way of signaling internal nutrient depletion. Without adequate absorption of critical vitamins and minerals, the skin becomes drier, nerve signals become less stable, and the body's repair mechanisms weaken. Moreover, malnutrition can quietly erode muscle strength, cognitive function, and resilience to illness, all without causing dramatic changes on the outside. The most concerning aspect of malnutrition in older adults is that it often remains invisible until serious complications arise. A normal weight does not guarantee proper nourishment. The encouraging news is that nutritional imbalances are among the most correctable health issues. Simple steps, such as adding a handful of nuts, incorporating a boiled egg, enjoying fresh berries, or taking a high-quality multivitamin, can make a significant difference over time. Reintroducing nutrient-dense foods, even in small amounts, can help restore vitality and ease unexplained skin discomfort. If persistent chest or abdominal itchiness arises without clear external causes, it serves as a powerful reminder. The body's internal engine may need better fuel to continue running strong. Listening to that whisper and nourishing the body intentionally can help ensure that the years ahead are not only longer, but also filled with greater strength, clarity, and joy. Now that the four specific areas of concern have been explored, it is time to pause and reflect. Have any of these subtle signs appeared in recent months? An occasional itch may seem harmless, but as experience shows, chronic or unexplained itchiness can serve as an early warning from within. Persistent lower leg itching may point to compromised circulation. Upper back itchiness could signal strain on the liver or kidneys. Scalp and neck itching often reflect accumulated emotional stress or nervous system fatigue. And ongoing itchiness across the chest or abdomen may hint at nutritional deficiencies that quietly undermine strength and resilience. The body rarely shouts in its early warnings. It whispers. It uses small, sometimes easily ignored signals like these to prompt attention before larger health challenges arise. The important message is this: none of these signs represents an unavoidable fate. Each one offers an invitation, an opportunity to take small but meaningful steps toward better health. Walking a little more, nourishing the body a little better, sleeping a little deeper, managing stress more intentionally, all of these actions can accumulate into significant improvements over time. If any part of today's information felt familiar, the best time to act is now. If none of it applied, that is a blessing, but it is also a reason to stay vigilant, to continue listening closely to what the body communicates as the years move forward. Because the ultimate goal is not merely to live longer, it is to live longer with clarity, independence, vitality, and joy. By paying close attention to even the quietest signs, like a persistent itch, we can walk that path with greater confidence and grace.